To welcome you to this week's coronavirus call, and I am going to go ahead and unmute Molly so that she can get us started. Hi, Molly.
Hi there. I'm assuming you guys can hear me.
Ken, we have a bit of an echo. Let me try to mute you.
Yeah, that's
Oh, I think it might be on your end. Do you have maybe the speaker on the computer on too?
I will check.
Oh, that was better.
Huh. Okay.
All right, let's just go with it. Maybe Amy worked her magic.
Okay, well, I'll just be quick. Welcome everyone to our 6th weekly COVID-19 call, as hard as that is to believe, or maybe it's not, because maybe it feels like forever, like it kind of does for me sometimes. Anyway, I hope you all are well. I hope you got out and enjoyed some of the good weather this weekend. I was able to get out for a walk with my mother-in-law, which was really important to do. She needed to get out of her apartment. She is a SASH participant in Heinsberg, so it was nice to see her, even though we had to keep our distance. But I hope all of you are finding something to do to really get away from this really difficult work. And so, as always, we just like to start these calls with a reminder about what our priorities are right now during this time. I know that you all are doing everything you can to meet these. I know the SASH administrative team that I work with is on this day in and day out. And I know that you guys are doing incredible work out there. I just recently sent a update to our key legislative committees that really support us and our funding on an annual basis. So I sent a update to all of those committee chairs and legislators, giving them an update about the incredible work that you're doing out in your communities. I wanted to make sure they knew that the SASH participants in their regions, their constituents, were still being well served by our program. So that went out. Just wanted to let you know that. And with that, I know we have a lot in this call, so I'm going to turn it back over to Melissa, but thank you all for being here. We have close to 70 attendees right now. Thank you.
Great, thank you so much, Molly. So as we always do, I'm going to go ahead and give you guys a chance to chat in any questions or discussion topics that you're hoping that we're going to talk about today. And again, just to let everybody know, I do read through the discussion chats afterwards. So if there are any questions that come up that we miss, we do try to include those in either the follow-up emails, or we send emails out individually to people with questions that we weren't able to answer on the call. So please do use that chat option. It does actually help us quite a bit to figure out ways that we can be helping. Some questions that we've heard today, this week in the field, are some questions about what to do without foot care being offered. Some questions around ending self-isolation guidelines. So after Sabina talked with us last week, we had some questions come in asking, what does it look like when you have a patient that's positive with COVID, go through their self-quarantine time and be ready to be able to leave their apartment again. We also have some questions coming in about ways that we can help support new staff, people that have actually started with us during this COVID time. We have had quite a few new staff start with us, and it's been an interesting, different kind of experience for them. So we wanted to talk about that a little bit. And then any questions that you guys may have. We also have another presenter today. So we're gonna just go ahead and get moving because we have a lot of great content to cover. The first thing I want to do, as I always do, is just go through the numbers. So for this week in Vermont, we are up to 812 positive cases, and unfortunately we have lost 38 people so far. In Rhode Island, there have been 4,706 positive cases, and they have lost 150 people. And in Minnesota, they have 2,356 people, and they've lost 134. So the numbers do continue to grow. We're hearing in lots of news reports across the country that people are starting to kind of hit their peak and level out. And so far, the numbers are showing that, although they still continue to grow, they're growing at a less quick rate than they were before. So that's where the numbers are at for this week. Casey, did you want to talk to us about some of the SASH initiative updates?
Sure. Can you hear me?
I can, yes.
So when this all started, I incorrectly assumed that people would become less interested in focusing on their health right now, that they would be primarily concerned about the crisis in front of them. But more and more kind of anecdotally seeing the opposite being true. There's a huge increase in people interested in quitting smoking, for example, according to the Vermont Department of Health 802 Quit. So people, as they're hearing about the virus and hearing about what puts them at risk for the virus, are actually more becoming, and of course this isn't everybody, but people are becoming more concerned about their health and in some cases more interested in how to improve their health so that if they get sick, they can better fight off the virus and be less likely to have serious consequences. And of course, our grant work and our initiatives have to continue as well. So this is a really good time to be focusing on health for everybody, but particularly with our participants who have diabetes or hypertension or heart disease, that puts them at even higher risk than the general population of having serious consequences if they get COVID-19. So just wanting to encourage people to check in with your participants about hypertension. And I have another slide specifically focusing on hypertension coming up. Melissa,
Thanks,
do you want to speak to this?
Yeah, before you do that, I just wanted to let everyone know that our, especially in Vermont here, our MCO grant deliverable, which is that big grant that we have to report out to the state on every year, is coming due in May. And as far as we know, that is still going to be the due date. So we would like to ask everyone to please get all of their assessments into PHL by 4/26, which is this coming Sunday. It would be helpful if Minnesota and Rhode Island can do that as well, just because when we do this big snapshot in time, we like to be able to look at all of the data. Also, if you missed giving out any drug or alcohol education brochures to participants that should have gotten one, you could mail them. That's an option, or you can wait until you see them next to give it to them. And then Amy sends out her annual JOT form around group programming. So if you can please be sure to complete that by, I think it's the first week in May, that would be great. Let me move, there you go, Casey. Here's your slide on.
Thank you. So we need to keep focusing on all the chronic conditions, but as you know, we have a special initiative targeting blood pressure, and this is going to go out to the nurses as well, but I wanted to share it with everyone because SASH coordinators and nurses can be talking about this with participants. So the ask is really to review your monthly status report, your logs, your notes, and remind yourself who has a history of elevated blood pressure or who you might be worried about right now, whether it's because of medication compliance issues or just that their blood pressure is hard to manage. And then to make sure you're checking in with those folks, and maybe they have a blood pressure monitor that they're using at home, and if so, what have their numbers been? Are they using it? Have they had any changes or issues with their medications? And a lot of folks have changed their diet somewhat right now because they're relying more on canned food or more on frozen dinners, and of course those can be really high in sodium, so talking to people about that. And then also assessing, and you don't need to ask specifically about symptoms because most hypertension is silent and we don't know when our blood pressure starts to creep up, but some symptoms of severe hypertension, which might indicate there is a problem and they need to get checked out right away, is headache, vision changes, dizziness, definitely chest pain and shortness of breath, pounding in the chest or head or ears, nosebleeds, fatigue, and flushing. So if you're hearing about those symptoms or people are complaining about a lot of headaches, that getting their blood pressure checked might be really important. And so what we're hoping we can do, one of the things we can do is to offer blood pressure cuffs as a loan. So loan them out to your participants to self-monitor. This can be for the duration of the stay-at-home order or for as long as they need them. And that, of course, would have to be dropped off at somebody's door, and then nurse education on how to use it would have to happen by phone or by Zoom. And if you're able to do that with your participants, you can also provide some tracking sheets, provide education on salt reduction and exercise and stress. I think that would really be helpful for participants. And there are, during these times with increased stress, less exercise and diet changes, I think there probably are a lot of people struggling with high blood pressure.
Hey, Casey, we have a couple of questions that came in.
Okay, I see what is flushing. And flushing is when your cheeks are, I mean, usually you can see it in the cheeks, but it can be in your chest area too, is when you feel all of a sudden really warm, kind of like a hot flash. You get red and warm. Let me look at their other questions here.
Yeah, April asked, would we recommend participants with high blood pressure monitor their BP at the pharmacy stations?
They certainly could if they're going there already. I would think that may be, I wouldn't, if somebody is quarantining or isolating, wouldn't send them there. If they're having symptoms such as chest pain or shortness of breath, they need to be going to see their primary care or maybe even going to the emergency room. So if they're already there, yes, I wouldn't necessarily recommend somebody leave isolation to go do that. I know some sites have blood pressure monitors, but we're also asking people to stay out of community rooms. So yeah, I don't have a super great answer to that question.
Just as another question connected to that, Sarah asked, where would we get auto blood pressure cuffs to loan out, and would panels need to purchase them?
So we have some that we can get to you, and certainly email me what you need, and we're working on getting more and getting them sent out to folks. I don't have a clear answer yet on how many we'll be able to get, but send me an email what you're looking for, what size, and how many you would like for your panel.
We also have here, Maxine says that Kinney Drug has given her free blood pressure cuffs.
Wonderful.
Great. Thanks so much, Casey. I really appreciate it. And Maxine, that was great timing, because hopefully you are on the call now as we have you up next. Maxine Adams is a SASH coordinator covering all of Lamoille County, and she has been with SASH, as far as I know, from 2013 on, so for quite a while. Correct me if I'm wrong, Maxine, but she is going to talk to us today about running a group program remotely. Maxine, are you there?
So she is there, but she's self-muted. So Maxine, I can't, you've called in on the phone, but oh, there we go. Try now, Maxine.
Yeah, okay, so I'm sorry, I didn't understand I had to do that too. So, okay, good, yep. Can you hear me?
Wonderful, hi, we can, and I've got your slides ready.
Okay. So, one of the things I've done a lot of, and yes, I have been a SASH coordinator since 2013, is focused on the exercise classes. And I teach Tai Chi, and I do bone builders, which recently morphed into arthritis, AFib, arthritis foundation exercise program. So I call it now arthritis friendly bone builders. And so when the Corona thing came along, it was kind of actually my bone builders group was really upset and sad, and they finally one of my more enthusiastic exercise persons said, well, why don't we do an online class? And I went, oh, more software to learn. But anyway, I said, okay, you get together the list, and I'll learn Zoom. And so that's one of my so since then we've done 3 weeks worth of classes twice a week on Zoom. And I started to write down all the little hints and everything that helped me make it work. So the first one I just mentioned, which is get somebody that will help you. And so I got her to do some of the work of getting all the because it's a lot away from your duties if you have to do a lot of this. So get a friend to help. Get somebody from the class who's very enthusiastic, who's willing to promote it, and then get a Zoom account. And I recommend that you somehow get somebody to pay for the monthly subscription, which is only $15 a month, and you can cancel it if everything turns back to normal. Then you don't need it anymore, maybe, so you don't have to pay it. And maybe the DRO will pay it, your sponsor for your housing sponsor. That would be a good thing. But the 40 minutes that you get for free just isn't enough time for an exercise class. You need an hour. So it's called a pro account, and the limit is 100 people, which you probably won't achieve. And there's no time limit, and that's great. So the next step was to learn Zoom, and the SAGE tutorials are excellent. They're the best way to learn how to work Zoom, how to get it, how to make it, set it up, and then how to make it work when you're having a Zoom meeting. So one of my hints was to practice with a friend on their computer and your computer, because you can set up these little ad hoc meetings, and you can learn a lot by just in fact, it's about the only way to really learn the details of it is to keep playing with it, and play with, find a friend who's going to help you learn it. And so I've come across a couple tips on how to do the settings. So what you have to do once you get your account, and you get all the identifications that go with it, you get your personal meeting ID and all this other stuff. But the tutorials will tell you all about that, so I'm not going to go into it. But some of the tips to be sure to do is, when you go into the setup, is to name your meeting every time, so that you don't get them all mixed up. So find a unique meeting, because now that I use Zoom, I use it for a lot of other things besides just the exercise classes, but I'm just telling you about how to do an exercise class here. So the thing called waiting room, which is a security thing where people, when they join, they're put into this, isolation. They can't talk to others or see their screen yet. I have to say it's a little inconvenient with a large group, because you have to admit people, even though you can admit them all at once. But with the folks that are likely to be using it, they'll think something's wrong if they don't see the screen right away. Let's put it that way. Another hint is auto generation of the meeting ID. That's kind of it's good because it can prevent someone from joining you from an old link, which can mess you up if they arrive before you. What I have found is one of my exercisers likes to come 15 minutes early, and she's using an old link, and then when I join, I'm on that link, and then everybody else is on the other link. So it's a thought to use auto generation. You can play around with it. You can also ask almost any question on Google, and there will be information on how to work Zoom. Another hint is telephone and computer for the audio. Always choose that, because some people actually will have to just phone in, and that'll be good enough for them. They're happy. They don't want to see this, or they can't see the screen because maybe they don't even have a computer. Another is unable to join before host. So one of the things that this is trying to conquer is some of the social isolation. So it's a little cumbersome when we get up to 20, 24 people in the class. But initially, when people are coming in a little early, they can have these little chats. And you have, in order for that to work really well for them, you put it in what's called gallery view, and the tutorial will show you how to do that. Also, be sure to check the setting for improve my appearance, and it'll make the wrinkles go away for those of you that are like me and have lots of them. Some of you young folks, not so much. So, tips on settings. Okay, so then you have to invite people to the meeting, and there's a couple tips about that. When you schedule the meeting, and all of this is in the SASH tutorials, but when you schedule the meeting, they give you an opportunity to copy and paste the email invite into it, and you can copy it right then when you're doing the scheduling, and then you paste it into your potential email, and we'll talk a little bit about the email addresses later. But I kind of dress it up a little bit. I take off information that isn't relevant. Like if I know everybody's not using telephone, I take that information off, because it's just some people just aren't, if they're not in the business world anymore, they just really find it confusing to read an email and pick out the important things. So try to make this as easy for people as possible. And I enlarge the text of the link, and I put anything I can in red as opposed to the black, so that people's eyes will be drawn to that. And I find that it's good to describe a little bit about the steps for joining, what they'll look like on their screen. So I think some of people have a little bit of trouble with, if things don't go fast enough for them, they don't understand, life with computers, and that it sometimes can just take a long time for, like 10 seconds, and they'll move on to something else, and then they'll mess up getting in. They can't get in. And then, of course, your cell phone will start ringing. So I usually tell them a little bit what they can expect, and I tell them that they should. I've decided that it's best if you invite them the day before or that morning, because of it's sort of hard for people to find old emails and know where they put them and all that other stuff. So so I see in the discussions there's a lot about the privacy issues. I have to say Zoom is trying to work on it. I feel like, since we're not talking about HIPAA things, I know that sometimes they've dive bombed pornography on and everything. I haven't had a bad experience though with it, and I think owning an account and using some of the security measures that they give you is good. So you send the email, and then they have it, and they have the link, and then when you're in the meeting. And so some of the meeting control hints that I have, excuse me, is that when you start, you tell people, okay, now I'm going to mute you, And then you enter speaker view as opposed to gallery view. So speaker view is whoever's talking gets the big screen, but you want to stay talking. So you don't want any noise coming from anybody else. If it's possible, they could unmute the mute that you gave. You mute it all, but I don't know if it always holds if they hit unmute. But if you pin your screen, when your screen is large, you go up to the 3 dots, the blue dots that are on the screen up in the upper right-hand corner, and you can pin your screen to being the big screen. Also, you need to be the big screen because if you're doing the exercise things, you want to see if what you're doing and if you're in the right position for people to see your feet, your legs, or whatever's happening. So in the Bone Builders exercise group, we have pauses, like we go from our balance routine to our cardio routine, say, for instance. So at that point, I usually unmute everybody and ask if things are okay. And people are always willing to help you out with what could be better. Excuse me. And also, don't forget to set your volume output on high, because you're not going to be sitting in front of your computer in an exercise class. You're going to be, maybe 10 feet away, just so your whole body, if you're standing up, can be shown on the screen. And also, don't forget virtual background. You can always put a nice ocean scene behind you, especially if your husband walks behind you in his sweatpants. You don't want that on the screen. Okay, so set the stage. So you have to kind of decide ahead of time. I have to actually set up the stage about 15 minutes early. So for sitting and standing, if you're doing both within the routine of the exercise program, a lightweight chair is better that doesn't have any arms. So you can move it a little diagonally so they can see what you're doing with your leg or whatever, or your feet. Have your weights and your water handy. Have your computer screen on a table. If you're really technologically endowed, you can have a big screen so you can see what you're doing better, but I just use my portable. I put it on the table. I have to angle it. It takes a couple tries to angle it so that when I'm back 10 feet that my whole body is showing. And have a light background. A light background is best, and if you're wearing black. And then it gets a little dark near the floor, so I use white socks or white sneakers so they can see what my feet are doing. And if it's important, whatever, like in Tai Chi, it's kind of important right or left, but in Bone Builders, it really isn't. I read somewhere that if you put a colored band on your right arm, then people can understand what is right, what is left. Because I think the way it goes is that you're still mirror image to them, so it's kind of tricky. So I need a cheat sheet because I've never memorized my routine, so I write it on a poster in big dark, big Sharpie, black Sharpie, and I have that hanging underneath my computer or alongside of it off the table, because that won't appear on the screen. And if you want to have the best lighting, it comes from overhead and the sides and the back. Don't do a big spotlight on the front, because it bleaches everything out. So then we've got, the end. So that's new to everybody. There will be problems, but everybody is understanding and they're really helpful. And they're just happy to be talking to their friends and doing something together. So they'll help you. They'll be understanding if you know, if your dog comes in and wants to sit on your lap, and it just adds to the fun. And that's about it.
Maxine, that was so helpful. I cannot believe how much you've learned about Zoom. I need to take your class because I have not learned nearly that much.
Well, I enjoyed it.
Thank you for sharing. And we did have some questions that came in. You saw there were some about the privacy, and I think that we had mentioned that they now have you can put it as like a password protected invite. So hopefully that will help deter any people from joining that shouldn't be. There was a question about if you could do like a singing group on Zoom, and it sounds like that you could possibly do as well. And I just want to give people a chance to see if there were any other questions to come in before we move on. But I loved this. Everything about this just was so helpful. And I really appreciate that it was kind of participant driven. Somebody reached out to you and said that they were, looking to do something like this, and you just made it happen. So thank you for that.
Yeah, it's been fun. It's been fun. It's like I'm so resistant to learning just one more technology, but I'm actually glad we did it. And I have to thank this one enthusiastic participant exerciser that I have, and she was very helpful, very helpful.
Hey, Maxine, there was a question. Oh, yeah, go ahead. How many people are joining?
Well, here's the irony of it. My bone builders class, the max we would ever have would, on a good day, would be 17 to 18 people. I've got more than that. I've got people, I've got like sometimes 24 people that want to be in the class. So yeah, managing the email list is challenging, to be sure to update it when they give you their email, so that when you send out the invitation, you've got all the emails on it.
Wow.
But worth it.
That is great. Thank you so much, Maxine. I really appreciate you coming on and sharing. And I would say if anybody has any questions that they didn't get answered, please feel free to reach out to me, or Maxine's contact information is on STAR. I'm sure she wouldn't mind answering a question or two either. So thanks again, Maxine, and I'm going to move us along. So we had a bunch of questions come in during the call last week, or just over the past week, maybe on some of the nursing calls that Casey has been sharing. And so we wanted to go through and answer some of those questions. One of the questions was about what to do to help participants when there is no foot care being offered, and especially for those diabetic participants that need that regular foot care. Kathy Rosenberg from Minnesota shared this great article with us, and it's kind of hard to see on the screen, actually. It's that light green thing on the bottom, but I will send it out in the follow-up call email afterwards. But please feel free to share this with your participants. There's a whole article. I just pulled out the top 12 tips that you can do, but it does walk you through what each one of these would look like for a participant. And I think that it would be something that might be really nice to share in a flash, or to even, if you have people that email, to share the link. And it looks like there's somebody saying that lotion between toes is not okay. So check it, I guess, and make sure that you agree with it before you share it. Another question that came up was how long after Sabina presented her case about having a positive participant that tested positive for COVID. I'm trying to use like proper language because I don't want to say a positive case. It's not really person-centered language. So we have a participant that tested positive for COVID. We had questions come in asking what happens when they go through their self-quarantine period. And so Casey, I thought if you could walk us through that, that would be great.
Sure. I think this is a kind of a confusing topic because there's kind of different programs for depending on whether you've had the illness or whether you've possibly been exposed to the illness, and so there's different protocols which in some ways seem a little counterintuitive. So if somebody has the virus, so they get sick or they test positive for coronavirus, they need to self-isolate for 7 days, and then after 7 days, if they don't have a temperature, they no longer need to isolate. if they're still having a temperature, they need to continue to isolate until that temperature returns to normal. And that's without temperature reducing medications like Tylenol or Advil. So a participant will not need, or a staff member does not need to self-isolate as long as their symptoms are going away after 7 days. And they may have a cough for a lot longer than that, so it can last for several weeks, even though the infection is gone. The only kind of caveat to that, which is not on this, is the fecal route, which there is concern that the virus may spread longer than that. So encouraging them not to use public bathrooms, not to use the bathrooms on your site, that would still be important. So 7 days after somebody has a positive test, they can stop self-isolating. If somebody has a possible exposure, then they need, or if somebody they're living with comes down with COVID-19 and has symptoms of COVID-19, they need to self-isolate for 14 days because it can take that long for the symptoms to appear. So if somebody in the home gets a positive test, whoever they live with needs to isolate for 14 days from the day that first person started having symptoms. They may, at some point during those 14 days, get sick themselves, and then they need to self-isolate for 7 days from the time they first start having symptoms. And if they never get symptoms and they never get sick, they can stop isolating after 14 days. In the ideal world, there'd be a lot more tests available, and the tests would be able to help with this plan, but because they're still, they're not testing people to find out that they are no longer positive. This is the current guidelines.
Hey, Casey,
that,
Sabina
yeah.
just typed something in. I don't know if you saw in the chat about what you were just saying. She said that the info she received was that a person without symptoms needs to isolate at least 7 days, but a person with symptoms needs to isolate at least 14 and then be without symptoms for at least 3. And she said she got that info from the UVM MCHHH.
Right. So, and I didn't follow all of that. This is from the Relias webinar and the CDC guidelines on that. So,
Okay.
Paul, I'm trying to find Sabina so I can.
Yeah, it's up a little bit further. It's up above Becky's comments.
So, I see Paul's comment, which is that his partner had COVID and he was told he has to isolate for 14 days from the first day with no symptoms, from his first day with no symptoms. I think the challenge of this is we're talking about a couple of different pathways. So I'm trying to find Sabina's. Okay, I found it.
Okay.
Input we received was that a person without symptoms needs to isolate at least 7 days. So I'm assuming, Sabina, that you mean a person without symptoms but who has tested positive needs to isolate at least 7 days. That's consistent with this, yes. But a person with symptoms needs to be isolated at least 14 days and then be without symptoms for at least 3 days. I've not heard that. I have heard that you need to be fever-free, and it has to be at least 7 days from when you first start having symptoms. So we can get some clarification on that.
Yeah, absolutely, Casey. And I think another question might be if it's a case of having someone that's tested positive versus just someone that's having symptoms. So why don't we get some clarity on this, and we'll just include it in the post-call email. I think that'll be great because there's also a lot of different sources. So we want to make sure that we are gathering and there's there's a lot of chats coming in. So we will work on getting clarity around this and follow up in the email that comes after the call. Thank you for all your questions. I appreciate it. Anytime we say something that you've heard something different, please let us know because we're all just doing the best we can, trying to make sure that we get out the right information. So we will share in the follow-up. That actually is a really great segue into my next slide. So as I talk with people throughout my day, whether it be from SASH, my family, my friends, I'm hearing and also I'm saying one thing over and over, and it's basically just that I'm so tired. I hear this from everyone, and people tell me how actually their daily activity seems to have decreased right now. There's less running around, getting kids to various activities, less participating in things going on in the community, overall just less hustle and bustle in general, and yet everybody kind of feels more tired. So I did a little digging because I just found this to be really interesting. And I found this great article that might help explain it at the BBC. It's the address is on your screen, but also I'll share it after the call. It talks about the exhaustion of choice or decision fatigue. So I'm going to share just a brief little excerpt from it because I thought it was fascinating, and I personally found it to be quite helpful. So the article says that with news changing all the time, information is constant, whether it's about the pandemic itself or whether it's about things you should be doing, schedules for your kids, how to best work at home. Overall, it's just a lot of information. And in other words, the COVID-19 pandemic is forcing us to rapidly grapple with different decisions in an unsettling new context. So normally, we're not thinking about the ethical implications of ordering delivery or whether or not to get groceries for our elderly neighbor. Those are just things that we would ordinarily do. It's a psychological stress that most of us aren't used to, and we've never experienced anything like this in modern times. So on an hourly basis, our top concerns can swing from how we keep our families safe to what the kids are going to eat for dinner. And you have these wide range of decisions that go from basically like borderline life or death on one end of the spectrum to snacks on the other end of the spectrum. And people are still just trying to figure out how to exist in a world where that's what your range of decision making looks like. And it can lead to what they're calling, or what is called, decision fatigue. So that, combined with the pressures that we're putting on ourselves to make smart, safe decisions for ourselves and our family and our communities, it can just lead to a very pandemic-specific burnout. They say that people need to find things that work for them. So whether it's meditation or solitary walks or binging Netflix, it really just needs to be very individualized, and there's not necessarily a right or wrong. The advice is to keep the big picture in mind, to think about it as this is a season, it will pass, it may be difficult, and there's a lot of scary stuff between point A and B, but that point B does exist. And every day we're in quarantine, we're getting closer to that point. So I was sharing the example today that my daughter and I were exercising yesterday, and she asked what music I wanted to listen to. And it just broke me. I could not think of a genre of music to say, because it was literally just like one decision too many for me at that point in the day. So I encourage anyone who may be feeling similarly to read this article. I found it very interesting, and I will again share the link. So we're talking at various state levels about reopening in whatever that looks like. So in Vermont here, our Governor Phil Scott is talking about reopening the state, and he's using this faucet metaphor where we will be reopening in a phased, systematic approach, like sort of one turn of the spigot at a time. And we at the SASH admin team are working on our plan for how to do the same within our program. So we're considering what services could restart, when they could restart, what services will likely have to be delayed, such as those great group programmings that Maxine's doing over Zoom might continue because in-person group programmings are probably going to need to be delayed. We know that Minnesota is currently set to reopen May 4th, Rhode Island is May 8th, and Vermont is May 5th. We are hoping to have plans and guidance out to you in the next week or so before any of those dates get here. So please know it's on our radar, and we are trying to figure out sort of like our systematic approach to that as well. With the news covering the phased reopenings that we just talked about, as well as the weather getting warmer and people just really getting sick of isolating, we are starting to see more people out and about in our buildings and our communities and our parks. Please remember and remind your participants, because they are the population most at risk, that physical distancing is still important. Wearing a mask out in public is still important. It might be a really good time to remind residents that we still need to be taking these precautions. I might put up new signs. I might, or use the old signs and just kind of rework them a little bit to grab people's attention. I might put it out in my SASH flash, but I think that just reminding people that we're not quite done yet, and even when we are done, it's still not going to be done. We're going to be phasing into this new norm. I think it's going to be really important to keep our participants safe that way. I see some chats going on, and I did say that May 4th was what I had read for Minnesota, and May 8th was what I had read for Rhode Island. So if those have changed since I looked it up last week, they very well, if you're there, you probably know much better than I do. I looked it up last week for one of our slides about the stay safe at home orders, but they very well could have been updated, and I didn't catch that. So please don't take my word as gospel. Casey, you had wanted to share information with us about this great training resource.
Yes,
just to specify, to answer Hillary's question, Vermont is May 15th. I may have misspoke, but
so this is Amy is doing an amazing job sharing lots and lots of webinars on STAR. A lot of them are upcoming webinars, so obviously those aren't pre-screened. We don't know how useful they will be. But I did want to just call attention to some of the new Relias webinars that I've watched several of them and have found them to be particularly helpful, especially from a nursing standpoint, with some really good information on those webinars. And I wanted to try to clarify a little bit of the confusion about them, because this is from the Relias website, so relias.com, and on there are on-demand webinars, and also you can register for ones that are coming up. And so those are not through our Relias account. So you don't go on to STAR and click on Relias and put in your password to find those. These are through relias.com. So I just wanted to clarify that and encourage you to view those. And there's lots of other really good ones on STAR as well. Amy, was there anything I should add on that about how to access those? I know that was a question that came up a few times this week.
Yeah, no, I'm glad that you clarified, and as asked me, I've told that you do not need to have a Relias account to access those. So for the people on the call who are not in our Relias systems, you can access them directly. And for people who are in Relias, you don't have to go through the system. You just click on these links. And also just add, I'm pretty sure all of these are free.
Great. Thanks, Casey. And then I think you wanted to talk about just the idea that staff are joining us now, and it's a really weird time to be onboarding somebody in this remote sort of way. So it came up about how are we helping people get to know their participants and helping participants get to know them. So Casey, if you want to talk us through that too.
Sure. Yeah, there's several staff who are either started during all of this or who started just before we went into the stay-at-home order. So it looks very different for them, and I'm sure all of you who've been with SASH for a while know how stressful it is and confusing it is to start any new job, but to then try to do it under these circumstances. So I wanted to just share this slide and ask for either suggestions or support for those folks, and kind of the message that Amy and the admin team has been giving to them is, take a deep breath. This is not what your job is going to look like forever. This is not normal. And then finding ways to help them connect. And it's really hard, as you know, it's hard to connect with people over the phone, especially if you don't even know them. So encouraging a lot of the newer staff to partner with their coworker, whether it's a new nurse partnering with the SASH coordinator or new SASH coordinator partnering with their nurse on those phone calls or on Zoom as you connect with participants. And that may take more time, but establishing those relationships is super important. The other thing is for new staff is to personalize their phone messages on the office phone so people get used to hearing their voice and know who you are. You can do individual plans with people and check in and just get to know folks. I think one of the things that's unique about SASH and also takes a little getting used to is that we spend a lot of time just chatting with people, just getting to know them and just establishing those relationships. So talking about their pets or what they're working on or what they're doing during this time. This is a great time to just have long conversations with people. You can meet people outside their building. You can call them from outside and wave and introduce yourself that way so they can connect with a face. And just keep reaching out and letting people know that you're there. I know Amy has connected a lot of folks with mentors. Again, this is a great time to be reaching out to your mentor, joining your mentor, and the PowerPoint disappeared on my screen. I'm not sure where it is, but oh, there we go. And seeing if you can join your mentor for a meeting they're holding, or if a participant is willing to kind of listen to how your mentor might do an assessment and be a part of that and listen in. And the other thing is to please take care of yourself. That you have permission to take breaks, and please ask for help. Ask for help from your coworkers, from the admin team. I can see that there's lots of stuff going on in the chat. I don't know if it's related to this, but
Casey, you probably can't see it, but it's just some really great conversation about people talking about how they connected when they were new and reaching out and just reaching out to new staff and trying to help make people feel connected in ways that they probably wouldn't have ordinarily. They would have just done that in the office or at meetings or whatever. So it's been a really fantastic conversation to read on the sidelines, but I didn't see any questions coming about it. So thank you for that. And then I think the quote of the day was yours this week too, right? Yep.
Yes. And this is I stole this out of the Relias webinar from this week, and this is from Dr. Kevin. I don't know how to say his last name, so I'm not going to try, because I think. So what he was talking about, he's an ER doctor, I think in North Carolina, and the big concern is people not coming into care. And so his quote is, "People are getting sicker avoiding medical care right now than by accessing it." And I think that's a really important quote for right now, because so many of our participants are putting things off. They're not going in to their doctor. They're not calling their doctor. They're not going to the ER. And what we're seeing nationally is more and more people getting sick, getting to the ER much later than they would have under ordinary circumstances, and negative consequences of that. So encourage your participants, if they have a health concern, to go to their doctor or to call their doctor. And maybe it can be addressed by telehealth and maybe it can't, but calling the doctor and getting care is really, really important.
Thanks so much, Casey. And then while we just have you chat in your last questions, anything that we maybe didn't get to, I wanted to just say thank you so much to Michelle Sawyer. She is leaving our admin team and going to a new position that she'll be starting remotely. So all that stuff we just talked about with the state. We are very excited for her, although we're also super sad to lose her. So I just wanted to take a brief moment and say thank you, Michelle, for all the amazing things that you've done for our team. Some of the highlights for me being the STAR intranet. Michelle set that up, helping to roll out Minnesota, SASH in Minnesota, and all of the great work that she's been doing around really making sure our quality is top notch. So thank you so much, Michelle, and best of luck in all of your future endeavors. You will be missed here. So I will leave the chat open for a little bit. I see lots of wonderful love coming into Michelle, so we'll make sure that she sees all that. And please feel free to chat in any questions that you may have had that we didn't get to. We will follow up with our email as we always do, and we will get some clarity around some questions that we had. And I just thank you all so much for everything you're doing every day to get us through this and to get our participants through it as well. Have a wonderful day.